some of Kelly Starrett's stuff. You know, that was a nice conglomeration of him looking back historically and seeing what has worked in the past from some of these kind of older PTs and docs. And what they found is guys in the NFL and power lifters and these big dudes just are crushing foam rollers. So they started moving on to PVC pipes, right? And that was working okay. And then they started putting concrete inside of the PVC pipe. So just adding weight and adding weight. So what you'll see here today is some smart people came up with basically a hollowed out foam roller. It's completely metal. I bought this one empty, if you will, and then I poured concrete into the top and the bottom. This thing weighs about 135 pounds now. So you can see how that progression from laying on top of a, you guys remember back in the day, those white foam rollers that after 3 months would have the little, you know, dent in the middle, and then we have these high density black ones, and now I have a 135 pound roll. So the intent of going heavy is not necessarily to get like clicking and popping out of your joints or mobility from that perspective, but let's just say if you're a 500-pound squatter, you need to get your tendons and your ligaments ready to tolerate 500 pounds. And a little foam roller or some dynamic mobility might not quite get you where you need to be. So the intent of today is to show you some strategies to get you from warm-up to training as fast and as efficiently as possible. I'm not standing here today saying I'm gonna fix your rotator cuff or I'm gonna all of a sudden remove your low back pain. That's not necessarily what we're talking about, but I don't know about you guys, but I show up to the gym sometimes with like some knee pain or something like that. That's not necessarily clinical per se, but certainly gets in the way of a quality session. So I don't want to spend, or I don't have the time to spend right now 30 minutes to get my knee ready to squat. I work out in my garage, my kids are all over me, and I just don't have that luxury. So this stuff for me has been invaluable. Where I found it to be the most impactful was with my pro athletes, and for the same reasons. They need to get ready to compete much faster. But where they fell in love with it was on the recovery side of things. How to kind of move some of that nasty tissue around. You know, whether you believe in like the pooling up of lactic acid or not, sometimes it takes manual force to kind of move that stuff through there. So today I'm going to show you some protocols, if you will. I'm going to show you my kind of like squat prep, if you will. I have an ankle case I'm going to work on in front of you guys. I clinically evaluated this one beforehand, so we kind of know what's going on. And then I was chatting with just a gentleman. He's a dentist with some forearm pain, so I'm going to show you guys a forearm protocol too. As we get through there, if we have any questions, if you guys want to see any specific stuff, let me know. But ultimately, I'm just going to be kind of demoing some stuff on whoever is willing to be demoed on. But as we're going through this, I'm happy to offshoot, get into some different topics or other. So when it comes to squat prep, we oftentimes have to consider what kind of low back do you have. And I'm going to make some very broad stroke statements and say that there's essentially two kinds of low backs. There's the kind of low back where it's really arched, the butt is out, and the chest is in front of the pelvis. There's the kind of low back that has no curve, and it's just stuck here, super straight. Now that's not my back, I can hardly get there, but you see those people, like their spine is just as straight as an arrow. There's no curve to that. So we're gonna operate under those two kind of concepts here. Someone with a little too much arch in their back and what they should do to prepare for squat versus someone who has kind of this really, you know, low curve, not much, you know, support as far as that's concerned. Anyone willing to get demoed on? I could demo on myself, I don't mind, but anyone wanna, yeah, cool man, step on up. All right, so if you don't mind, go ahead and just kind of stand in the middle here, and you can face that wall.
On here?
Yeah, that's perfect. You mind if I roll your shirt up a little bit?
Yeah.
Okay. So essentially, we're going to look at his back. His isn't that bad, but we're going to assume that he's an overly arched type guy. He's got some really strong extensor muscles in his back, and that probably pulls some arch into his pelvis. Some other structures that might be tight are his hip flexors, his quads, or his hamstrings. So the first thing we're going to do today is we're going to try to get his hips out of this arch position and kind of set back a little bit so he can kind of prepare essentially for squat or deadlift or to load his back. So we're gonna start laying flat on your back, please. Everyone familiar with the quad when I talk about anatomy? How it kind of comes from here down to your knee. So when the quad gets tight, it's gonna take this bone from the front and pull it forward. So in his case, that's the first thing we're gonna do, is I'm gonna set this heavy roll kind of right up into the top of his quad, and that's gonna start to create some traction and literally set the pelvis down into the socket. We're gonna do that a little bit on both sides. So when you're talking about body tempering as a practice, there's two styles. There's static, where you just set the weight on there and let it sink in. There's dynamic, where we kind of move the weight through the tissue, and then I haven't named my own strategy, so if you guys have any cool thoughts, but I'll show you how I do it in the clinic, where I combine static, active, kind of dynamic, and moving through. All right, can you scoot? Sorry, just keep me there. Yeah, thank you. Doc, go ahead and lay back there.
Just relax.
Right. Don't worry, I'm a doctor. So, again, anatomy is somewhat important. It is a little bit of like a seek and destroy method. You don't have to be an anatomist to understand this, but like in his case, this is that bone, right? So I'm gonna gently set that roller kind of right into that area. Okay? Yeah. So this would be what we would consider static rolling. If you could imagine, if you're looking with your x-ray vision, the weight of the roll, I'm gonna push this a little bit, is pushing down onto where his quad comes up and inserts into that pelvic bone, and when it gets tight, is gonna create some malposition. So this is one where it feels good just to sit, right? It feels okay, right? Yeah. So what I like to do in the clinic now is move that pelvis around, reposition that thing to try to get it where we want it pre-squat. So, you familiar with pelvic tilting? Concept of that? Okay, so bend this knee. So what I want you to do is try to take and turn your pelvis backwards. So yes, there you go, good, yep. And then now take it the other way. Good, a little slower. So if you can appreciate what he's doing, he's rocking the pelvis back into position, he's driving it forward, all under the compression of, I'm not a physicist, but whatever, 45 degrees minus 130 pounds or whatever. You okay there? Yeah. Okay. So for the sake of demo, we're just gonna treat that one side. You okay there? So now I'm gonna have you bend them both up. So now we wanna get both of those pelvic bones sliding back into position, again with more of like a static approach. So I'm gonna set this right across your lower stomach. You're gonna take your hands and push it into your thighs, okay? Don't tube. So this particular device is made by a company called Kabuki Strength. They are out of Oregon. They send it to you hollow, which is magical when you know buying equipment for shipping is nuts, right? Mm-hmm. So they send it to you hollow so you can fill it up. It has this little spine cut out in the middle already. So in this case, his pubic symphysis, that bone right in the middle, the cutout is not pushing on that and not pushing on the other stuff in that area as well. So nice to have that. So essentially, I want you to just push it into your thigh. Do you feel how your low back is kind of pushing down into the table when you kind of relax that? So this is a static approach to physically taking that pelvis and creating some posterior tilt. And he's just gonna chill there and breathe. Doing good? Okay. So from here, you don't have to do this if you don't want, but from here we work up into the pecs. The guy that created this was one of the first guys to squat 1,000 on the platform. And he and his lifting buddies primarily used this strategy to prevent umbilical hernias. That's what they found it to work for. They always would talk about, if you go down with something as simple as a hernia or a pec tear, when you're an elite performer, the time it takes for you to rehab and get back to where you were before, your competition is training and they're getting away from you. In the world of powerlifting, like, you have no time for injuries, unfortunately. So in this case, what they would do is bring this up a bit, right?
Yeah, so it just feels like there's pressure like on the hip bone.
Okay, so roll a little bit more up if you can tolerate. No, towards your head.
Oh, towards, yeah.
Okay, better? Okay. So now we are on the guts. We're literally on his belly button, the umbilicus, and as he's breathing, the force that that's putting down into his stomach is making those ab muscles actually a little bit more pliable. We want them to be rigid, but they have to be mobile. If you're, a stiff board with that amount of stability, it's actually not ideal. We want a little bit of movement from the abdominal wall. You okay?
Yeah.
Okay, push back into the relaxation. Good. Okay, I'm gonna take this off of you. All right, switch me spots. You okay? So typically 3 minutes is what we would call a good static tempering. So from there, I'm gonna do this one so you don't have to. I'm gonna bring it up onto my chest, show you guys how we mobilize the pecs. So again, we're talking about squat prep, right? So we've just opened up the quads a little bit. Now we have to open up the chest to be able to address the bar. So what that looks like, when I'm at home, I literally just kind of get over, roll that thing right onto my stomach. Now from here, this is totally safe. It may not look like it, but I'm gonna roll this up to my chest, put my arms here to protect my chin, and now I have static tempering right through my pecs, opening up my rib cage, 135 pounds, no chance I can create that on the foam roller, and I can just breathe and mobilize my rib cage. As I roll that back down, I can literally keep it on my stomach here, just breathe, open up that rectus right in the middle, push it onto my thighs just like you saw him doing, and let that crush into my low back to create a little bit of a position of relaxation. Static tempering is really nice. You can just kind of lay there and breathe through it. Go ahead and drop back there. The dynamic version of this is way more painful. Thank you for being a demo. Yeah. So straighten this one. So because these crash pads work so great, we're going to keep the angle.
No.
So now I'm going to let you do this one, okay? Okay. Go ahead and sit up. So now he's going to roll this thing down towards his knee.
Oh.
And you're going to find some nasty spots in there. Go ahead, back and forth. So this would be the dynamic version of rolling. And when you find that spot that doesn't feel good, like right around, I would assume there. It's all good?
Yeah.
Okay.
You don't lift them up. You don't lift.
Most of us have like a little bit of like a trigger point in our quad on that lateral portion there, and this is just working through that thing. So far, so good?
Yeah.
Okay.
I have a question.
Yes, sir.
About whether you're doing this on a, if this is taking a lot of that impact
Yes.
versus being on a more firm.
That's a great question. You never want to do this on the ground. If you have a crash pad or even one of the smaller ones, I'll show you on the elbow, you want to have something underneath you just so that you have a little bit of reprieve from the pressure.
So I'm definitely feeling it more when I'm hitting the edge.
For sure.
Versus having a little bit more surface. Is that what you aim for?
It's not necessarily the aim, but now that you have felt that, and you guys don't have these in your gym, here's how you guys work these.
Steve's already ordering it on phone.
So now you take the bottom of the kettlebell, right? So it's significantly less weight than what I put on him before, but now he can do some spot treatment. And because the bell is flat, you have an edge all the way around. So you're gonna wanna push that to the edge.
Oh yeah.
Now that he's on the edge, he's got some spot treatment, and he can work across the quad tendon just a little bit either direction. Same thing, 3 minutes is always kind of our max or repetitions in this case. But right now we have the edge of 53 pounds going right into his quad. In the clinic, I like to joke, I'm like, no one ever died from having, 53 pounds on their quad. But that's probably not an appropriate joke in a social setting like this. But ultimately, the goal is to 8 out of 10 out of pain, really. I mean, you can take it up there for short periods of time. Good.
So when you filled the other one with the weight, were you aiming for like 130, 135 pounds?
I
Or is
think,
that
yeah.
like just a good weight for
So
that?
basically, if it's all the way full to the total top, I think you can get it close to 160. At the time when I purchased this, I was pretty much running a youth athletic performance gym, and I didn't want the full 160.
Okay.
Also, having the ability to get your hands in there
Yeah.
is really valuable. They did put some rebar in there, but I like just being able to hold that thing. So
Okay.
while I wasn't exactly shooting for that particular weight, once we kind of leveled it out and put the concrete in and hardened up, that's kind of where we stood. The big dogs throw like steel or lead shot in there with the concrete to make it heavier. So
Okay.
this is a great way to buy this thing because you have full control over it as it becomes empty. Okay, so we've got dynamically rolling through. I've got some other tools that we use in the clinic that are much like the barbell, but this spot treatment stuff is really where it's at. So I'd like you to lay on your side facing the group, please. Bring this one back and this one forward.
This should be, I want this to be my poster.
So spot treating now for the groin, the adductors, as they come from the knee all the way up into that pubic symphysis bone. We're gonna use today, again, just the kettlebell because it's what you guys have access to. So now he is on the meat of the adductor. So the flat part of the bell is engaging the meat of the muscle. So as he rolls that into his adductor higher up into the ledge here, now he's got that edge, 53 pounds, right into the hip. So what I'm gonna show you now is the way that I've been working with these tools for about 5 years or so. So now that he's here, I want him to actively stretch. Open up that hip. If you're a sumo deadlifter, this is magical. If you're a really wide squatter, very good as well.
So if you're having some like groin irritation, this would be good.
It's a good place to start, right? I don't want to sit here and tell you that I'm going to fix stuff by having you jam heavy weights into it, but it's not a bad place to start. Okay, so if you feel comfortable, maybe we'll higher. Oh, yeah. The bell higher. The closer we get to the tendons and the insertion point, the more this like edge with mobility, like that is nice, right? Good. Kind of roll over it and roll back. So now that he's here, he's got his pelvis really kind of stretched out. Let's assume he is a sumo deadlifter and he needs a wide stance to address the bar. I want him now doing the same pelvic movements he did when we were laying. So I want you to arch that thing. Yes, good. Bring it back. Okay, good. Just moving the pelvis underneath the tension that we're creating with the tool to get that thing moving. Again, our main goal is how do we get him on the platform faster? How do we get him under the bar a little quicker without having to do a ton of warm-up sets? And now essentially we've loaded those tissues with movement. Loaded mobility is really a good thing. You okay? Mm-hmm. Good. All right, thank you. Anyone else with a maybe not a big low back curve, a little less of a low back curve that wants to demo? All right. Anyone just want to demo? You want to feel it? Yeah. So let's lay on your stomach, please. I'm going to have you scoot just a little towards me so I don't have to walk all over. Okay. So obviously in his case, he's not our super flat low back. However, we can kind of demo on him anyways. But what I'll show you is the hamstring, the glute, how we come up into the mid back, really mobilize the entirety of the spine, and then what it would look like to do some static tempering. Do you have any pain with that though? Don't tough it out. Right? Oh, no. Okay, good. Take it. So safety is always first. Like in this case, I'm going to bring it over to him and then lean it onto him as opposed to holding it over like I did on the other gentleman. Thank you for your chest. So right now I'm on his glutes, just on that sacrum, that tailbone in through there. And with this one, I like a little bit of just oscillation left and right. It's a really stiff joint, so it doesn't move much anyways. So just a little bit of oscillation goes a long way. And now what you can do, so I have full control of this tool. I can twist it and really start to open those glutes up behind his hips. You okay, man?
Yeah.
This one's a little tighter. And it's amazing, you can feel that through concrete and steel, that extra tension in this left glute. So I can come down here now to his ischial tuberosity, right where his hamstring inserts into his hips. I can really get in on that thing. I can come down into the meat of the hamstring.
Oh, yeah.
Now, when I roll this back up, you okay?
Yep.
I'm gonna come into his low back. That first roll is a little sensitive. Now we're into his low back, driving into some extension. This could be a spot for static tempering. Just letting it sit here. You okay?
Yep.
Do you have any pain?
Nope.
Okay, come up on your elbows. Someone with a really nasty low back, you okay with this one? Tends to like this position. You can actually see as he breathes, the roll will start to sink in. You know, like for me in the clinic, I literally have to push on people, get down on top of them to get this. This is just a great way. He can sit here, breathe, get some decompression actually in the low back, because pressure or compression, if you will, creates traction. I know that's kind of maybe a flighty thing to say, but we see it all the time. Like when I do voodoo floss band on her ankle, it actually creates traction in the subtalar joint. I'm compressing it, but the result of that compression is some distraction. You okay?
Yep.
Okay, back on your stomach. So this is the crowd pleaser. Everyone likes this one. Put your hands underneath your chin. So I'm going to come up into his low back or his rib cage here. You probably hear a little clicking and popping with this one. And no, this doesn't put me out of business as a chiro either, so it's all good. So here, obviously, if you do this here, partner, you gotta be careful as you get up to the neck here.
Some good stuff.
Yes. So what I can do now is I can really grind on that shoulder and get those ribs.
Yeah. Get in there.
If you have some knots under like the shoulder blades, is that a good way to get in there because it's open?
Yeah. So this here, it just depends. If you've got a bad shoulder, you do not want to push that thing further into the socket. He's strong, he can take that, you know, his shoulders are durable. I'm not going to push that thing out of the socket. But a lot of your trigger points are going to be in between. Do you mind standing up one second?
Yeah.
You okay? So I'm sure that feels good. Loosen up the back. He's been on the floor all day. Probably feels nice. So the three most common trigger points in the back are, the number one is upper trap. It's like the most common trigger point in the world, right here. It's hard to get the tempering tool in there. I'll show you guys some tricks for that. Second is the levator, which is right at the corner. So this one is always really tight. When both of these are on, they create this posture. It's up, it's elevated. The only place where that tension going is up into his neck or into his bicep tendon at the front of the shoulder. The third one, right about in there, is like that rhomboid area. So this gets tight when the shoulder is constantly protracted. It's too much stretch here. So the solution for this stuff here, oddly enough, is working the pec, working the chest, the anterior rib cage. We all want to smash on this back here and just keep moving it, but it is a byproduct of overstretch. So what I'm going to do in his case today, I'm going to work this to have an impact, if you can imagine, straight through to where that trigger point is at the back.
It makes sense because when it feels like there, it's pulling like in the front. So I guess it would make sense.
But our brain wants to attack the pain. We don't feel. Pec
Yeah.
never, like hardly ever complains. It's like, whatever, I'll get tight all day. Yes. But the back, no way. It's like, no, I'm too tight.
Yeah.
You know, you need to rub me or have your husband rub me or something. Like, get in there. So we're going to be on his stomach for a second, but I'm going to address your question. The big roll is not good enough. We need a more direct pressure. So on your stomach.
So when that center area is like super tight or contracted, what does it feel like? Because I know for me, there's certain things I do here at the gym, that I get like a stabbing sharp pain, like if maybe something's biting me or somebody's poking me with a needle in this center area.
Yeah. So the sensation itself sometimes can dictate where it's coming from. Like sharp shooting pain sometimes is more of like a joint issue, where like that diffuse kind of achiness can sometimes be muscle. I guess I would say the answer is, unfortunately, it kind of depends. But what I would always tell you is a test-retest method is the only way to figure that out. So if you notice that you have the tension in there, what do you do to get it to go away? If you're doing stuff directly on it and it's not helping, you got to start to look towards the anterior chest wall and what's happening here to kind of compress the rib cage at the front. So this here, what I'm going to show you guys is just a quick little 2-part series into getting the shoulders ready. 2 parts on the back, I should say, and 2 parts on the front. So the first one we're going to address is the levator trigger point, right? I'm not going to actually dig into his upper trap. I'm going to skip that one and get over towards this levator. If you guys need like an anatomy perspective, you can find the corner of the shoulder blade, and it's pretty easy to find that little trigger point right in there. So basically I'm going to engage the tissue. Maybe like an 8 out of 10. You okay there? Yeah. So I'm just going to hold. Just hold.
Are you pushing into
I'm
it?
pushing into it.
A little harder.
And I would just ask him, is this okay? 8 out of 10 is what we're looking for. It's his 8 out of 10. It's not my 8 out of 10, so he can let it go as high as he wants. We could have done some retest stuff. I apologize. It's a little bit more crowd pleasing, but I thought I'd just show you the points at this stage. Doing okay?
How does that big roller work with on a female or someone that's little?
So that's a good point. So that's why I have a variety of tools. You'd be surprised actually, if it's well placed or well positioned, your muscular system can take quite long. I mean, when you look at the mathematics of running, there's like 4 times body weight that you put through your calf on toe off. So if you take that number, your calves can tolerate whatever that is. It's certainly more than 135 pounds. So it's not no pain, no gain, but you may want to start lighter and appreciate that. It'll take you a few sessions to be able to tolerate something heavier, and that's totally okay. It's that alarm system that triggers, like, oh man, that's heavy, get it off there. But as you kind of relax into it, that's what happens when you jump, lift heavy weights. The tissue has to accommodate to that load, and can you do that before we actually get into it and just make that transition a little bit easier? The calf stuff, again, I keep kind of preempting it, but it's awesome. Like, everyone should probably do a little bit of calf and ankle work every single week, just because of how much we do, jumping, running, standing for long periods of time or other. So we'll get into that here in a few minutes. The next position, or the next spot, I'm gonna have to have you sit your arm back by your side, is pretty tight and sore on like 90% of people. And they all have a spot that they know, like, oh yeah, that's it, you know what I mean? So in this case, I have an idea where it's at, but I'm actually gonna ask him to tell me if I'm, really hitting the spot. Got it? So this would be the spot where your lat dives underneath your shoulder blade to wrap around to the front of the shoulder. Lat essentially, especially in a close chain atmosphere, is an internal rotator of the humerus, right? So when you were a little baby and you were learning to crawl, your lat was the thing that would lock your elbow to the floor and allow your chest to come up. Now we use lat a lot now to move our humerus closer to our body, but in a closed chain situation, when lat is closed chain, it likes to internally rotate the humerus. Too much of that with pec and upper trap leads to nasty shoulders, specifically in that bicep tendon or the front of the shoulder. Okay, do a couple more here, right? So like in this case, I'm pushing him hard enough that I'm actually pushing him away from the tool. So my other hand is just kind of approximating him into the pressure. About there. flat on your back. So we just worked the left. Let's see. So that's pretty good. He's got his knuckles all the way back to the floor. Not too bad on this side. I don't know, maybe 2 fingers, not quite there, right? So I'm just gonna do pec. That's it. I'm gonna do pec on the right arm, nothing else. So we talked about trying to find those trigger points, maybe where you think that they're on the back, where you can address them from the front. Too much?
So one place you will not look at.
Obviously not much of a great spot for females. You can go a little higher. This case would be probably his 5th rib. Pec minor is the smaller pec muscle that starts from the upper few ribs and actually attaches to the shoulder blade. That is so important to appreciate the difference in where pec major goes versus the smaller version of pec. The big version of pec is going to come on to the arm, much like lat, give you a little internal rotation. Pec minor attaches to the shoulder blade, and it's going to give you that where your arm just dives forward, your shoulder blade is elevated. That pec minor has literally forced your shoulder blade into a bad position. This one is pretty tender too, so I have to grab the meat of his pec to get that out of there. And with female clients, this works okay too, because you're still kind of in a safe zone there. So I'm just lifting that pec, getting underneath there,
Eey.
Ow.
and now we're treating pec minor. Tell me, back down.
So if you have some like popping or slippage movement up in there, like in this rib area, is that stemming from like weak pec muscles or tightness?
Yes, weakness in the back.
Okay.
Yes. I know these guys take good care of you, but when you think of it, it should be like a 2 or 3 to 1 pull to push ratio if you're having any of those issues.
Okay.
Lots of pulling. It's usually when you tell them it's okay, it'll feel better when I'm done. So, not the full protocol. Right?
Oh yeah.
That's not even like David Copperfield trying to, you know, like that's just better, right? And we didn't even do his trap and the other side. So that was less than 3 minutes total. He can now grab that bar and get ready to rock. He still needs his warm-up sets. I'm not saying that you know, negates warming up, but however long he would have to warm his pecs up just to address the squat, now we just did that in a few minutes. And that's what I'm here to try to emphasize to you guys today, is that there are tricks to get you under the bar faster. There are tricks to take some of these chronic aches and pains, maybe not fix them, but just crush them for the next hour so that you can train pain-free. So just a quick little recap of what I would call maybe like the squat prep, right? You have to do something to get your pelvis properly aligned. Know your own body, right? We all have different backs. It is very helpful to work this upper third of your quad, from this ASIS bone down to where the meat of the quad is. This is an area that, especially if you're a seated profession, you get stuck at your desk all day, it gets short in through there. And you know, we need to loosen up psoas or hip flexor, which is what we're gonna do next. But if we can't get the tension out of quad, it doesn't matter how loose you can get your hip flexor, the quad is tethering the pelvis to the knee. And when you go to descend on squat, especially if your mid back is tight, you can arch, and just squeeze those discs. Just pinch those things in there. And it's not sciatica, right? It's not like raging into your leg, but it freaking hurts, right? So this is a way to maybe prep for that. The dynamic version of it is to get down, surge through the quad if you can. You can use a barbell for this if you don't have the bigger tempering tools. The barbell works really good because it has the ability to roll. So he would be creating pressure here as much as he wanted, using the Neuralink, so again, that would be a way to do dynamic tempering with the barbell. The static stuff, We talked about spot treating with the kettlebell. The important thing about treating with the kettlebell is recognizing that you have to use the edges, right? Putting it flat takes that 50 whatever pounds and disperses that through the 3 or 4 inch diameter that is. You have to kind of pull that onto the edge to make sure that that 50 whatever pounds is actually going through the treatment spot. The best area for that, quad tendon, rolling out, capture that IT back in, laying on your side, getting into the adductor. I showed you what I like, you know, moving the pelvis, opening that up. That's a great way to get the hips ready. However, we cannot forget about the necessity of thoracic extension, shoulder mobility, and being able to address the bar that way. Good. Thanks, man. Questions?
So, this is just prior to workouts?
Prior to workouts.
As often as you can do it.
Yeah. Okay. Well, no, prior to workout for sure is a movement prep. As far as cool down is concerned, that is when I think it actually has good value. You know what I mean? Where you like it the best is a little bit of trial and error. For me right now, it's mandatory movement prep for the simplicity of getting into my workout quicker. But because I'm a chiropractor, I'm using my hands a lot, I do like to lift. I do maintenance work on my elbows and forearms just for maintenance, you know what I mean? I don't do that necessarily to prep, but I try to do 3 days a week of the protocol that I'm gonna show on this gentleman today, okay? You ready? So we're gonna do hip flexors on her first, and then we're gonna do her ankle stuff. So flat on your back, please. That pace one is freaking rowdy. Ooh.
This one doesn't look like it's supposed to be a magic trick.
So, when we're looking for psoas, you find your belly button and you roll just like 2 inches or so down. It's not way out to the side. A lot of us think that psoas as a hip flexor is way out here. There's a secondary hip flexor muscle called iliacus that sits inside the bowl of your hip. Psoas comes from the lumbar spine, and they have a common tendon as they get here. To address psoas as a lumbar spine muscle, we need to address it in relation to the belly button, not in relation to the ASI. So what she's basically doing is she's just off her belly button, she's holding that weight straight down into her hip flexor, and she's just kind of breathing and allowing on exhale, it kind of sinks in a little bit. So we've done this, what, 2 times? Yeah, so we know she can tolerate this. So where we go next is a contract relax method under the tension. So she's gonna lift her knee up into the air to contract hip flexor, and then let it kind of come back down. Lift to contract, lower to relax. Anyone Tom Brady fan in here?
Who's that?
Yeah, right? So, he came out with this book last year at Christmas, and his soft tissue guy came up with this term called pliability, and it blew up in my little world of soft tissue work. All they did was added contract relax to massage and created this cool new word for it. We've been doing this for a long time. Contract relax has been a stretch method for years, but under pressure, it does have a very unique response to the relaxation phase. She could probably attest to when she contracts and relaxes, much like breathing, the tool seems to start to sink a little bit more. Go ahead and switch to the other side. So with this, whenever you're gonna go into a dynamic movement, you wanna start static for, I don't know, maybe 30 seconds to a minute or so, just to let the tissue accommodate. You can add pressure, so if she wants more, she can kind of like search that out, try to find where it really feels good. And in this case, good means it hurts a little bit more. And now go ahead and contract.
About how much does that weigh?
This one is under 30, so it would be like that yellow kettlebell for you. The other one I have here is closer to the green handled belt. So I think you guys have the hip flexor tool in there, right? So that thing has some value. You know, that's more of a static approach, right? You're statically addressing the hip flexor by laying on top of that thing. So how can you create this contract relax method? Again, we're going to come back to the faithful bell here. So when you are using the bell, you're going to be obviously capturing a little bit more of psoas and then that iliacus. So what we're going to do is we're going to turn the horn of the bell so it's going vertically with my body, right? So that's my belly button is here. The depth of the bell would be right where she had the tool before. Now the trick, much like we saw with him, is getting the edge to engage the tissue. The flatness is okay to accommodate. We need to engage through the edge to really get, you know, the force down into the tissue that we want. Okay. So I'll let you do it. So go ahead and grab the horn. So she's going to roll out to the edge a little bit to try to find those spots. Roll up, roll down. Just want to kind of find the edge. Once you kind of find it, it's like right there. Once you find it, let it sit statically, and then add the dynamic movements. Good. Static before dynamic. And in this case, we're going to lump dynamic up into when you're actually moving your muscles as well. Okay? You want to kick one of your shoes and socks off for me, please? Yeah, please. Thank you. Come towards me just a little bit. So when you're wrapping the band on your ankle, if you've ever had your ankle wrapped professionally before or before competition, essentially what you always want to appreciate is that you don't want to collapse the arch. I don't want to wrap her in a way that pulls her arch down. Even though she's blessed with good arches to begin with, I don't want to be smashing that down. So I'm going to pull the tension of the band to support the arch in her foot. Now from here, I'm just going to make like a figure 8 around the ankle. And what the official term is you close the windows, meaning I'm trying to cover skin wherever I can at this point to make sure that we have good compression everywhere. If you have more band, you can come up onto the ankle a little higher. In this case, we're going to focus on her foot in the subtalar joint. So we're going to stay pretty much in this zone. Okay, so from a compression perspective, how tight would you consider that?
Pretty tight.
Pretty tight. So it's okay to really crank this one on there. 3 minutes is always going to be our thing. So normally I would actually be working this thing, moving left, right, traction, but I'm going to show you today how I'm going to have her do it if I'm not here, okay? So we haven't done this one. Go ahead and stand up. So we're going to use the wall, some classic ankle stretching strategies. So go ahead here. So she's going to be stretching this leg. So we're going to free this knee up to the wall, and go ahead and lift. So what I want to happen is I need her to squeeze her glute to drive this whole thing to the wall. Good, and back, you can step back over if you need to. Good, now go once with the knee straight. This knee straight. And yep, there. So as you guys know, we have the gastroc and the soleus. The gastroc crosses the knee joint to the hamstring, so the knee has to be straight. Go ahead. Keep the knee locked. So, gastroc, knee is locked, stretching across the knee. Soleus, short foot flexors, knee is bent, driving out here. The compression around the ankle is taking all of those tendons and fibers and smashing them together. So as she moves, they have to slide. If tissues don't slide, they create friction. Friction creates inflammation. Inflammation creates pain. We need sliding of these tissues. So we're going to take now into some different angles. So she just went straight in. Now she's going to go over the top and really mobilize that subtalar joint under compression here. One more.
Straighter.
To the side. And then now she's going to come the other way. So big lateral lunge towards the garage door. Yep, keep the heel down. Yep. There we go. Good. And back. Good. Okay, you come off there. So during, it is not overly pleasant. Afterwards, however, your foot is nice and loose. Your ankle has been mobilized, and you are ready to squat or other. So, compression under mobility, similar to what we had talked about with adding like the kettlebell and stretching and moving through there. So on her other ankle, we're gonna just do the static compression on the Achilles, okay? So you mind if I wrap the other one up there? Questions so far? So as of now, everything I'm showing you, you have tools in this facility to accomplish what we're talking about. Okay, again, wrapping to support the arch. Do not collapse the arch when you're wrapping the foot. So the goal of this one is less into like the foot, more into the Achilles. So I am going to come just a little higher onto her calf than I did on the other one. Let me know if it's too tight, okay? I'm going to stop it, please. And then just leave this one hanging off to the side of it. Okay, so we've got, again, just from an anatomy perspective, gastroc crossing the knee into the posterior kind of hamstring. We've got the soleus, which is kind of more into the middle of the meat here. They all come down, they start to form the Achilles, and then all these other little flexures of the foot. So basically, we're going to do our static tempering right onto her Achilles tendon. It's just going to sit. It literally just sits. Now this is the lighter version of it, because as you can tell, I kind of crushed her on the other foot there, so I'll give her a little bit of a break. But I do like the bigger tool a little bit better. Kettlebell does not work great for this, unfortunately.
Barbell?
Barbell, yeah, absolutely. So this would be, again, 3 minutes, just sitting here. Dynamically, everyone loves this one. That's another good static spot, right where the soleus is really thick, the meat of the gastroc is at its greatest. You wake up with heel pain, your foot is just stiff. This is a great static tempering spot right here. What's your pain level, would you say?
1.
1?
Yeah.
Does that mean you want the heavier roll? Or? Okay. So again, what you'll see now, I'll try to get out of your way, is what happens with this bigger roll. That is some good tissue compression right there. And just like to the point we talked about before, if she's gonna go for a run, she's gonna put 3 to 4 times her body weight just through the big toe joint every time she toes off. She can run for a while. She's got good endurance, so that's a lot of pressure. So it's not crazy to think that I'm putting right now 40-ish pounds through that piece of meat. Now, as we get up here, if you can see her face, she will be telling you how much she likes it here. And this is, again, a magical static tempering spot right For those of you who are big squatters, and big by, I would say, I mean 300 pounds or more, maybe even some of you females may like this behind the knee decompression. It's not a necessarily totally safe spot just to let it sit. Like in her case, I know she can take it for a few minutes here, but you know, anyone that I work with that squats heavy, they love the way this feels behind their knee. You can get through there a couple times. And that's the combination of the compression and either static or dynamic tempering. This is a maintenance style movement, I think, as well. I think that we don't really take great care of our calves. Go ahead and flip over on your back. I think that we just expect them to show up and work a lot of times, and then with 30 seconds of stretching afterwards that they should just be okay, right? Where our calves can tolerate so much work. You can walk all day, you can walk up hills, you can run. They are workhorses, but yet we just give them 15 seconds of mobility and call it good. In my clinic, if someone has foot pain, 45 seconds is a requirement. Like I have to get 45 seconds of constant stretch on gastroc to even assume that it's gonna have any type of tissue change. The IT band, they've shown in research up to like 4,000 pounds of pressure to even get that thing to move. Get off your IT bands. You're not gonna really loosen those things up. Get into your glute, hamstring, quad, and gastroc a little bit. Last thing, go ahead and lay back here. We have the tibialis anterior at the front of the ankle. Its job is to kind of hold good dorsiflexion in through there. The calf dominates the tibialis anterior. If your calf is tight, if you have posterior ankle tension, the front of your ankle is just at a mechanical disadvantage and it just can't work as well. You can roll. So I have it angled, so I'm not rolling onto the edge of her tibia there, but I'm into the meat of that tissue. You can slowly trace the edge of that. And I'm not really pushing, I'm just letting the weight of the tool sit there. Is that too much pressure? And I'm just kind of working through that tibialis. Just trying to get some blood flow in there. Just kind of prep that ankle. You can work that on a foam roller too. I do think tibialis works good on a foam roller. So ankle prep, compression is so good for that. You can even put the compression on and just walk around the gym a little bit. You'll get that same mobility that you saw her doing on the wall. The static tempering directly into the Achilles has a lot of bang for your buck because there's a lot of stuff traveling through there. My personal favorite though is to get up a bit into the meat of that soleus gastroc complex. There's a lot of stuff that actually starts from there, toe flexors or other, so that's a lot of bang for your buck too. So I guess what I would emphasize when it comes to ankles, do more. Just do more, and that's typically beneficial. Yes, ma'am? Totally, yeah, there is that camp out there of hypermobility for sure. Not that this is not an appropriate strategy for that. I think the compression is pretty good, but it's not in that case that you're doing this to improve mobility, but maybe for the strength prep and just kind of waking stuff up and getting it ready for load. That's actually when I think putting the compression on and just walking around a little bit kind of gets the arches of the feet and stuff kind of a little bit more prepared for something like that. Good question. Any other ones? Cool. All right, so I'm going to show you guys the forearm stuff now, and then from there we can do some spot treatment or whatever you want. Thank you for your help. You ready, man? Yeah. All right. So I need you to sit and see if this is too high. I have this other crash pad for you to sit on, but I need your arm up onto the black pad. You want this or you okay?
That looks good.
Okay, cool. The forearms, finger flexors, used a lot in the gym, are grippers, a lot with typing or other. He's a dentist, so he's got the, I guess, triple threat, if you will.